Lift your chin up and drop it down. I've worked as a chiropractor for just over 15 years now. I can see that you're a bit crooked. The job of a chiropractor is to find which joints are restricted, which joints aren't moving nicely, and to try and restore that movement as best we can. The brain controls the function of every single cell in the whole body, and it does that via the spinal cord. And the better shape the spine is in, the healthier the person.
Chiropractic treatment generally doesn't hurt. Occasionally we will get a patient coming in with very acute pain, and then it may take a little bit to release that joint, but we use as low a force technique as possible.
Is that painful there?
It doesn't hurt that much.
Good, excellent. We treat a range of people, from 7-day-old babies to my oldest patient was 99 years old. When people first come and see us, a lot of times they're in acute pain, or they've had niggling, ongoing chronic pain for some time.
Well, I had a lot of neck problems, several lower back problems, just like tension in my neck and my lower back as well.
Hold it there tight as you can. Good. We do a full physical examination, which includes a whole bunch of orthopedic tests to try and see which joints are working and which ones aren't. We also have 2 spinal screening scans. One's thermography, which measures temperature changes in the spine, and one is called SEMG, developed by someone who worked for NASA. It's a bit like an ECG, but instead of measuring the muscles of the heart, we're looking at the muscles of the spine. We show you what an ideal scan should look like, and we show you where you're at. And so we know what we're aiming towards. We want to try and decrease all this tightness, this muscle stiffness in the neck over here.
Before any of my adjustments, you could see where I was off the charts, and then 10 adjustments later, there's a result, and there's definitely more balance.
We also have digital x-rays. This makes it great in terms of lower radiation, beautiful clear pictures that we can pop onto a CD and give to the patients. So we have a really good look to see what's going on, and then explain to you what we found, and we talk about treatment options. We use something called activator. It looks quite scary, it really isn't. And what it does is a small little punch, and we use that to move the bone in the right directions. It's gentle and it's not painful.
When we're doing a chiropractic treatment for low back pain, we'll do a number of adjustments on the lower back. Generally, we'll position the patient in such a way that we isolate the specific joint that's not working properly. We'll be as specific as possible in terms of just getting that joint to move. Some people ask what the clicking or the popping noise is when they get an adjustment. All that it is a release of pressure from the joint. Surrounding the 2 joint surfaces, you've got a capsule, and inside that capsule is a special fluid that keeps the surfaces moving smoothly over each other. And when we do this adjustment, you get a little release of pressure from that, and that's the popping that you hear. It doesn't always happen in the adjustment, but it's nothing to worry about.
We treat back pain, neck pain, headaches, migraines. We also treat shoulder problems and elbows. For the most part, it's either a knock or a bang or a bump, a fall or a car crash, or ongoing stresses and strains, so something like bad posture. We see a lot of people with wrist problems and RSI these days from too much texting and things like that. We treat knees and feet. We have a gait scan, so we do foot analysis and gait analysis and look at how to correct the feet and sort out foot problems.
We also see patients that are athletes and they want to do better. I'm a competitive sportsman. I don't set goals that are easy to achieve. I want to push myself, and I want to make sure that my body's working as well as it can be. I love helping people get out of pain first and foremost, but then also we want to look after them past that and not just leave them until they have pain again and come back. We want to try and work with them to make them as healthy as they can be.
What you do is you hook one hand underneath the bench or bed or chair, and you pull forwards and away. Can you feel a nice stretch coming down here? So we try and get you into some healthy habits, give you some exercises and postures and things to strengthen things up so that the spine is working better and stays working better. Just being able to walk again without pain, or whether it's going for a personal best in a marathon, my goal and my aim and my ambition is to get people back to health and keep them there.